I'm Helen Yaffe, a lecturer in economic history at the University of Glasgow, and I'm on Zoom with Gail, who in 1997 founded MEDICC, a non-profit organisation based in Oakland, California, that has worked to promote US-Cuba health collaboration and highlight Cuba's public health contributions to the global health equity and universal health. Gail is also the executive director of the excellent journal MEDICC Review. So thank you for joining us, Gail.
You're welcome. Thank you.
I'd really like, I'd like to start by saying how much I admire the work that you and MEDICC do. I think you make a fantastically important contribution, and the film Salud was very enlightening for lots of people, as Cuban medical internationalism has often been referred to as the world's best kept secret. So I think the contribution that Salud made in telling the world with some detail about the forms of Cuban medical internationalism and the motives was very valuable. Also, your TEDx talk on where to train doctors was, which I believe has been seen by close to 1 million people, is another thing that I definitely urge our viewers to have a look at. So I would wonder if you could just start by telling us a bit about how you came to be so interested in Cuban public healthcare system and Cuban medical internationalism, and basically, you know, find out, go and be in Cuba, and how you came to set up MEDICC in 1997.
Thank you very much, Helen, and thanks to everyone who's going to see or has seen the film Salud. It was certainly an experience making it, and so I hope people really enjoy it and take away some lessons from it. I went to Cuba many, many years ago to see the social project in the flesh, as it were. And then many years after that, when I went to live in Cuba, working as a journalist, I discovered many, many issues related to the US embargo, which the Cubans, of course, call a blockade, related to not only the economic sphere most specifically, but really related to everyday life and how it was affecting Cubans. So to make a long story short, there was a group of lawyers in the States, attorneys, who were very interested to look at how the embargo or the blockade had come to violate the human rights of 11 million Cubans. And so that study was something that I was commissioned to do, and really took me back to my first love, which is public health. As a young girl, I had wanted to become a physician, but in my days in the United States, they weren't really giving out many scholarships to women to study medicine. As my father said, why don't you become a nurse? And with all due respect for nursing, I wanted to become a doctor, which I never did. So I became a journalist, and this study really landed me back into public health. And luckily it was used in the US Congress to lift some of the, as an argument to lift some of the restrictions on Cuba.
That's great to know that your work had a positive, tangible impact on Cuba. And could you tell us a little bit more about MEDICC and your objectives and how you're organized, how many people are involved? On your website, you have a list of the 10 sort of most outstanding projects, and maybe you could tell us about some of those.
Right. MEDICC, we founded as a result of the study that I just mentioned. We founded it with our original board members who had gone to Cuba to look at the results of the study and actually validate the methodology. And it was a bipartisan, in the context of the United States, Republican and Democrat group of people who realized in the process of doing this and making this trip that so many public health professionals and medical professionals from the States had gone to Cuba to look at the health system over time, but they had no real way of keeping in touch, no institutional bridge that would help them keep contact and learn from each other. So that's what we intended for MEDICC to do. And it's an acronym that whose name is kind of out of date now. It was Medical Education Cooperation with Cuba. But what it meant was we started out by sending US medical, public health, and nursing students to Cuba for elective rotations. And we sent about 1,200 of them with some professors to Cuba in the late 90s, early 2000. And then when changes happened, as they seem to happen almost daily in US policy toward Cuba, we weren't allowed to send students anymore. So we began to send health professionals, policymakers, people all the way from biotech to primary health care. And that's what we've been doing for many years in the Gateways Travel Program, which of course with both the US administration that we have now and the pandemic has been interrupted, but we hope to regain it soon. So that's one of our programs. Another program is the program that's dedicated to working with leaders from marginalized communities in the United States to help them go to Cuba and meet their counterparts there. So it's called Community Partnerships for Health Equity, and it's based on mutual learning. And it's been a fantastic program. We're very excited about it. There's a 13 city network now in the United States, all the way from cities in California to the Bronx and New York, New Orleans, Milwaukee in the Midwest, and so forth. The third program you mentioned already, which is the MEDICC Review Journal, which is taking Cuban and other Latin American public health, medical, and social sciences, and which are often written in Spanish or perhaps in Portuguese. And very few journals offer the opportunity not only for editorial and peer review, but also translation by experts. So that's what we do. It's all about the science, but it's about science with results for improved health and health equity. And then the last program is the program to support the graduates and the students of the Latin American School of Medicine in Havana. That includes students from many, many countries, but of course there's a special emphasis in our case on students, the over 200 students and graduates from the United States to go back and practice in, especially in shortage areas and in communities that are really in need of their services. One of the things in the US context that is so important is that they graduate with no student debt. In the United States right now, the average medical student graduates, becomes a physician with a $200,000 debt on their heads. So this does not encourage them to go into the lower paying jobs in areas like family medicine, which is of course where they're most needed. So that wraps up the programmatic aspect. The overall vision and purpose of MEDICC is to serve as a bridge between the Cuban and Latin American public health and medical communities, the United States, and globally to improve health equity.
Well, there's so many issues there that I would like to pick up and ask you to expand on. But let me start with this question. How could the two healthcare systems, that is the United States and Cuba, benefit from normalizing relations between those countries?
Well, absolutely. And it's very interesting. I talk with people all the time from the United States and elsewhere. And when you ask them about traveling to Cuba, often just out of not knowing, their first reaction is, how can I help Cuba? And I feel like saying, well, you might want to ask how Cuba might help you. So it is a mutual learning process, and that has been really stifled with the US sanctions over the years, and it's been very hard to keep it on track. I think that for the Cubans, it's very obvious that they are interested in the technology, they're interested in the medical research, they're interested in the investment in their own biotech and medical fields. So that's the area that I think Cuba is most interested in. It has very broad relations with the rest of the scientific world. So it's not as if they're isolated. I think actually it's the US health professionals that become isolated from Cuba, because the Cuban experience has been enormously successful despite the resource constraints of a small economy, despite the constraints that are imposed by successive US administrations with the sanctions. And it's an experience that we can all learn from. So I think it is a well-kept secret in some quarters, but among public health people in the United States, people working on fields as far abroad as climate change and other areas that are very much related to human and planetary health, it's no secret at all, and they're very anxious to get back to Cuba.
Yeah, so I published a new book earlier this year called We Are Cuba, How a Revolutionary People Have Survived in a Post-Soviet World. And one chapter looks at the development of Cuba's biotech sector, which is quite exceptional in global terms. And I interviewed this guy, Dr. Kelvin Lee, who is the director of research in a cancer institute in Boswell Park Cancer Institute. And they were in the exceptional situation of having received a license under the Havana administration during the brief period of rapprochement between the US and Cuba to work with a Cuban biotech institute. This is the Center for Molecular Immunology. And they had a license to work with Cuba's Simivax EGF, the lung cancer vaccine, and to trial it in the United States. Of course, lung cancer is among the top causes of mortality in the United States. So there's a strong incentive to, investigate a vaccine that has shown such efficacy and safety, which the Cuban vaccine has. It's already being used in quite a few countries around the world, as well as in Cuba. But even though they had received the license to start this collaboration, he was telling me the story of when they first tried to get the Cuban the Cuban vaccine to the United States to start to work with it. And the process was so complicated because, of course, there's no direct flights between that they could sort of delivery service that they could carry this thing on, and it's a It's a product that has to be transferred at a certain temperature within a certain amount of time, and they had to go through Canada, and they had to get so much paperwork, and then they get to the border of Canada and the US, and they're told that they don't have the correct paperwork, and it has to sit in customs while they get it over the weekend. And of course, by the time it arrives in Boswell Park Cancer Institute's laboratory, it's been too long. So they have to start the whole process all over again. So there's such an institutional apparatus blocking the collaboration between Cuba and the United States. I mean, there has been, throughout the periods, whoever has been president, there has been significant scientist to scientist collaboration. But what's been lacking is the institutional collaboration. So yeah, I think that's the point that you're making about how when people say, oh, we want to help Cuba, actually it's the reverse question, is how can Cuba help you, is a really important one. Cuba's biotechnology sector has many world firsts, and really there are innovative drugs that would benefit many people, including for diabetic foot ulcers and hepatitis B and meningitis B and so on. So I wonder if you could say a little bit more about that.
Absolutely. We have seen during the period of the Obama administration and the opening toward Cuba, we began to see enormous interest in Cuban biotech in the United States. And in particular, you mentioned one of the drugs that I think has particular relevance in the context of the United States and perhaps the world is the Heberpro-P for diabetic foot ulcers, which has been shown in studies to reduce the relative risk of amputation by over 70%. Over 70%. And we looked at the rates of amputees in the United States and found that there were over 70,000 people in the United States receiving amputations every year, costing an enormous amount to the health system in the United States, not to mention the cost to the actual people, to their families, to the loss of jobs and economic sustenance and income. It's just astounding. So there's a small company in the States that started to look for investors for bringing this particular medication to the States, somewhat like they did with the Simivax vaccine for non-small cell lung cancer at Roswell Park that you mentioned. But come the next administration, and all of this got shut down essentially in terms of the possible collaboration. So who is suffering? Cuban biotech is suffering because they're not able to export this medication to the States. But most of all, the people with diabetic foot are suffering. And if you look at how that shakes out in socioeconomic terms in the States, the highest rates of diabetes and untreated diabetic foot ulcers or minimally treated diabetic foot ulcers are among the African American, Latin American, and Native American communities. So we're dealing with a very serious health crisis that Cuba could have an important role to play in resolving.
Thank you for giving that detail on, the human cost of the refusal to engage with Cuban biotech. Can I ask you to say something about a comparison between the US and the Cuban healthcare system? The United States spends 5 times more per capita on healthcare than Cuba. And despite its scarce resources, Cuba has equal or better results to the United States. How can we explain that? Could you say something about the fundamental differences between the two healthcare systems?
Right, Helen, and it's even, I think it's even bigger, the gap between what is spent per person, and also the general context of the GDP. In other words, Cuba doesn't even have the GDP of a U.S. state, let alone the U.S. economy. I think the differences couldn't be more stark. In the United States, I see it myself. We have a system that is insurance driven, that is certainly profit driven. It is not necessarily medically driven, although it has very good medicine, at least for some. Doesn't have very good medicine for all. Doesn't have any medicine for some. So I think the first biggest difference is that Cuba's is a single, public, universal health system. And those words carry lots of weight. In other words, a single system means that if you're introducing medications, introducing health strategies, if you have a primary care subsystem, it's throughout the system. It's one system. A public system means that everyone is entitled to and is treated by the same set of institutions, whether you are in Havana or you're somewhere else. And it is not driven by profit. It is driven by healthcare and public health and medical science. And the third aspect, it's universal. So yes, I've been to a family doctor's house on the top of a mountain, and also to a hospital in rural areas, in urban areas. It's not the same as you will find in many countries in Latin America, the Caribbean, and Africa, where you find the hospitals only in a capital city. That's not the case in Cuba. You have medical schools across the island in every province. You have hospitals in every province. So I think the universal character, the single character, and the public character are are sort of the bedrock of why it's different. In the United States, it's really not a health system. It is an amalgam of many, many different kinds of health systems. Some people are covered by insurance from their employer. Many people are not. Some people are not covered at all. Some people are covered under Medicare for older people, Medicaid for poorer people. Some doctors will accept these insurances, other doctors will not. Some things are more regulated by the states, other things less. So it's such a hodgepodge that it is a miracle that anybody gets health care in the first place, in my view. And of course, we have over 27 million people who are completely out of the system. That doesn't happen in Cuba. I think the second big difference is related to the subsystem of primary healthcare facilities. We say over and over again, it's like beating a drum, that the primary health care is the key to health, is the key to a healthy population. But we don't seem to quite believe it in many countries. And I think that the Cubans have taken it to heart. They have a network of some 11,000 family doctor and nurse offices that literally dot the island. And they congregate around a hub of a community polyclinic, of which there are 450 across the island. And all of these are guided by programs to carry out programs in areas such as maternal child health, older adult health, communicable diseases, and the chronic non-communicable diseases. We're looking at the use of integrative medicine. We're looking at all kinds of things that they're able to implement across the system. And they believe very clearly in primary care, but also in primary care that prioritizes prevention. So one of the things then, I think, is another area is a highly educated population when it comes to health, not just formal education, which is also quite high in Cuba, but a population that is educated around health and their own health. So I think that's another big difference that you find in Cuba versus the United States. And then finally, I would have to say, in the last few years, we see an even bigger difference, which is that the Cuban health authorities believe in science. And right now, with the COVID-19 pandemic, we're seeing that in the United States, we have health authorities and even centers such as the CDC, which have been subject to terrible manipulation by politicians. And so we wonder, is this science that we're getting, or is it just rhetoric? And I think that that's a basis for a growing lack of confidence in our own country about what they're telling us. And you don't find this in Cuba. During the pandemic, for example, up until very recently, the head of epidemiology was going on television every single morning to report every single new case, every single new death in excruciating detail. Not the names of people, but at least their residence, their age, their underlying conditions, what had happened to them in clinical management. So people are very concerned in Cuba about the pandemic, but they're also very confident that their health system is doing what it can to protect them.
That's a really useful clarification about how the system works and what makes it so exceptional. That's in relation to the domestic healthcare system in Cuba. But of course, as we've seen in the film Salud, Cuba also has an unprecedented and quite astonishing record of medical internationalism. In your TED Talk, which again I encourage all listeners or watchers to go and check out, and hopefully we can have the link attached with this recording, you tell the story of how the Cubans, particularly Fidel Castro, came to see the importance of establishing a Latin American school of medicine. And it's quite moving. I wonder if you could just tell our listeners now.
It's quite a story. The Cuban medical cooperation in terms of sending actual health professionals abroad started in 1960 in Chile. Interestingly enough, they responded to an earthquake, but it happened to be, to this day, the strongest earthquake ever recorded in history. It was 9 to 11 on the Richter scale. So these health professionals were going into quite an amazing disaster. From then on, of course, there was more long-term collaboration that started in 1963 with the teams that went to newly independent Algeria. And I think this was really the first motivation for the Cubans to go abroad, which was that there was a real commitment to liberation struggles in the African continent in particular. There were all these new states emerging, newly independent countries emerging, and there was a sense of third world solidarity. It was the time of the non-aligned movement in its heyday, and so Cuba was very much a part of this, and what they could give was health. So if you fast forward up to 1998, when a number of teams were already deployed around the region, but there were two hurricanes that hit Central America and the Caribbean, George and Mitch. And these hurricanes prompted Cuba to send medical teams, emergency medical teams, immediately for disaster relief. Interestingly enough, some of them in Central America ended up being ferried around by US Army helicopters. This was sort of under the radar, literally, but that's what happened. And then as they were about to come home, there was a real dilemma because these doctors realized that they were the first doctors that many of these communities had ever seen. They were communities without healthcare. And if the Cuban doctors left, they would be without healthcare again. So a decision was made by Fidel Castro and other leaders that what would be the best resolution to this would be if people from those same countries could be trained to become their own physicians. And in fact, from those same marginalized communities, young people who knew their communities and who were committed to their communities and to their families there. So the Latin American School of Medicine was founded a year later in a former naval academy. You can still see to this day, there's a wonderful mural of a ship as you go into the reception area. And it's from its earlier incarnation as a naval academy. So the first students came from these same Central American and Caribbean countries, and then it just mushroomed from there with requests from leaders, prime ministers, presidents, organizations from around the world, actually, even beyond Latin America. So that's a misnomer now. It's a world medical school, and it is the largest medical school program in the world. They've graduated now, to bring people up to date from the film, over 31,000 students from 118 countries. So it's a big, big deal. And as I think I mentioned before, just like the Cuban students, they graduate debt-free.
Quite incredible when you think that Cuba is a small Caribbean island, which was subject to hundreds of years of colonialism and then imperialism, and since 1960, effectively, the United States blockade. And in fact, their medical internationalism, as the film, excellent film, Salud shows, it is more than just training people in Cuba. It's also, there's been huge programs to treat foreign patients in Cuba. So I'm thinking about the Children of Chernobyl program, and then subsequently the Operation Miracle to restore eyesight to people with easily reversible blindness. Then there's also the emergency medical brigades, which of course we're seeing now a very high profile in the context of COVID-19 pandemic. So these are called the Henry Reeve International Medical Contingents that are currently, the last thing I read was they've been operating in 39 countries around the world, specifically to treat patients of COVID-19. And these are brigades consisting of, again, nearly 4,000 Cuban medical specialists in disease control and disaster response. And then, as you said, with the case of Central America, there's the establishing the public healthcare systems, helping countries. And I know that they also did that in the 1970s in quite a few countries in Africa. How can Cuba afford to do this?
I think that you can ask how can afford to do many things. It's a question of priorities, really. They decided a long time ago to train more doctors and nurses than they might need. Today, there are 95,000 physicians in Cuba, for example, for a population of 11 million. But it's not really for a population of 11 million. It's for a population of 11 million plus those that are serving abroad. I think also in the very early years, there was no investment, and there was no money coming back to Cuba. It was all Cuba's investment in these programs. The only money coming back was from the stipends that the Cuban physicians and nurses would receive when they went abroad. As we moved into the new century, the new millennium, and relations, of course, during the Soviet period, during the period with relations with the socialist camp, there was a whole different kind of economic collaboration that was going on. And then we had this so-called special period in which the Cuban economy barely held on by its fingernails after the collapse of the socialist camp. And finally, moving into the new millennium, they were looking at different ways to really support the sustainability of their own health system. And when we say it's universal, single, and public, that means every single Cuban has a right to every single thing, not just the prevention, but also to a heart transplant if you find the correct donor. So we're not talking about something that is cheap. We're talking about something that involves real investment. And also, of course, medicine itself has moved into high tech over the past few years, higher and higher tech. And Cubans, of course, need access to that as well. So one of the things that they decided to do over time was to create a tiered system of global health cooperation in which the poorest countries would receive medical professionals from Cuba free of charge, with only the obligation to provide them with housing, with a place to work, with safe conditions, and a stipend. Often the stipend itself is paid by Cuba. Then there was a second tier in which the professionals would receive much bigger remuneration, in which the country would pay the Cuban health system, and then from there, the Cuban health system would pay the people going abroad not only their own salary in Cuba, which all of them receive, but also a fairly hefty, for Cuba, fairly hefty salary. So in addition, it's a plus that would be often 10 to 12 times what their usual salary would be in Cuba. Interestingly enough, I know that I think some people find it odd, but the Cubans, they have a rule, which is that if you want to have one of these more highly remunerated positions, you have to first go to one of what they call solidarity positions in a lower income country. It's a way of kind of testing the real mettle of people and if they're really volunteering to do this. And I do take the opportunity to say categorically that this is a job for which people volunteer. I know many people in Cuba who have volunteered, and I know others who have not been able to volunteer because of a family situation, in particular because they're needed somewhere, who really would have liked to have the opportunity.
So it's really good that you've touched that theme, because of course under the Trump administration, which has tightened sanctions against Cuba just since the beginning of 2019, I believe there's been 121 new sanctions, and this is against a country that has already been sanctioned and blockaded.
I can't hear you. For some reason you went out.
Sorry. Where did you lose me?
Sanctions.
Okay. So since just since 2019, the Trump administration has implemented 121 new sanctions against Cuba, and this is a country that has already been sanctioned or blockaded, as the Cubans say, for 60 years. So just at the point when you thought, you know, what else can they do? They have invented new methods of starving Cuba of revenues, of scaring off foreign partners, and generally trying to create a situation of scarcity in order to create a situation of discontent, which, as we know, was the original motive behind implementing the blockade, embargo, and when it began first in 1961 and then fully 1960, then 61. So the Trump, one of the things that has happened under the Trump administration is a real targeting of the medical internationalism, medical services exports by Cuba, which, you know, have become significant really since the Oil for Doctors program, the famous Oil for Doctors program with Venezuela, which began, you know, late 2004, and this was expanded through Latin America to include Brazil. Of course, that was the second most significant source of revenue from medical exports for Cuba, and Ecuador and Bolivia. And those programs were terminated with a very strong encouragement by the Trump administration, but by the governments of those countries, which hit Cuba hard. And particularly since the Henry Reeve brigades have been going around the world in the context of COVID-19, raising the profile, international profile of Cuba, and you know, getting a lot of appreciation internationally, the Trump administration has certainly been stepping up its accusations that the Cuban medical internationalists are slaves, and that this is human trafficking. And they've also threatened to introduce a new law which will punish countries that accept Cuban medics to work in them by adding them to tier 3 of a list of countries supporting human trafficking. So this is clearly designed to, you know, remove this source of revenue and prestige from the Cubans. But ultimately, the biggest victims of those programs are going to be the potential patients, people, as you say, in Latin America who'd never seen a doctor before. And as the Salud film shows, you know, people who could never have imagined having free access to quite high quality healthcare. So I don't know if you want to say anything about this sort of orchestrated attempt to undermine the Cuban example and the Cuban effort.
Absolutely, Helen. It's interesting to me that this is the same Henry Reeve contingent that President Barack Obama lauded when they went to West Africa during the Ebola crisis. So we see very clearly, just as this administration in Washington has politicized the COVID-19 pandemic, they're politicizing everything they can get their hands on to try to win this election. And unfortunately, the entire Cuba policy, I believe, is hostage to a small group in Florida still. Unfortunately, the lives of 11 million people in Cuba are hostage to a domestic policy concern to a domestic election, if you will, in the United States. And it's just reprehensible. It's not just Cuba that is held hostage, as you say, it's people around the world who could benefit from Cuban physicians, Cuban nurses. We just saw the first contingent, the first team entirely made up of nurses that went to Barbados in the Caribbean recently. It's just unconscionable. I think it's one more piece of evidence that this administration cares little for human beings, cares even less for poor people. And those are the people being really hurt, as you said, around the world when you begin to pull Cuban doctors out. And it is just false that these people are slaves. If you look at this, it's quite interesting. I read an open letter from a Cuban physician to Bolsonaro, the president of Brazil, when he canceled the contract with Cuba. And at that point, the Cubans had been serving 60 million Brazilians, 60 million. And of course, the line was that they were slaves, that et cetera, that the money that was going back to the Cuban health authority wasn't right to do that. And this man, this physician said, excuse me, my own family back in Cuba benefits from our universal health system. I agree with this tax on my earnings going back to our health system because we have a universal health system. And so my message to this White House would be, when is the United States going to have a universal health system that might need funding? We're not even there yet. And so I think it's quite ethically responsible for a small country, an embargoed country, a sanctioned country, as you say, already suffering from these kinds of really egregious measures, to look towards ways of making their own health system sustainable. And what better way than by collaboration with other countries who need it?
Yes, just makes you wonder, doesn't it? I mean, the fact that not only were the Cubans in Brazil treating 60 million, but they were treating 60 million of the poorest sections of the population in the most rural and difficult to reach areas, who were quite frankly not being served by Brazilian medics. And, you know, I think there's no coincidence that among the countries that have been most affected by the COVID-19 pandemic are the countries from which the Cuban medics were withdrawn under this sort of campaign of undermining Cuba. So now, as a final question, I'd like to ask you, it's linked as a counterweight to this sort of slur campaign. There is also now an international campaign which is proposing to nominate the Henry Reeve International Medical Contingent for the Nobel Prize. I just wondered whether you could give us your thoughts on that campaign.
Well, of course, it's very well deserved. These are people, extraordinary people, not just the idea of sending this contingent abroad, which of course was first happened and first was thought of to respond to Hurricane Katrina in New Orleans in the United States in 2005. When the United States said it didn't need any doctors, there was no shortage of opportunities. Unfortunately, we're facing, because of climate change and other factors, many more natural disasters. So the first time they were really dispatched was to Pakistan during the earthquake there. One of our journalists, a senior editor from our journal MEDICC Review, was able to travel to Pakistan with the Henry Reeve. And I have to say, her reporting was phenomenal. She then later traveled with them to Haiti as well. So we got a real inside look at the conditions that they work in, at the innovation, and at the adaptation to different cultures. One of the things they discovered in Pakistan was that women would only be treated by women doctors. And so after the first wave of the contingent was sent, they ended up sending another wave completely of women doctors from Cuba, because they wanted to make sure that that half of the Pakistani population didn't get short shrift. So these are very interesting learning experiences. The team is extremely well prepared over time, and really they put themselves on the line for people in the most precarious situations that you could ever imagine. Mainly poor people, people whose homes may have been destroyed, people who are ravaged by an epidemic like cholera. These are physicians, nurses, biomedical engineers who can fix literally anything, who volunteer and come back, I think, not only better professionals, but better human beings for having taken on this challenge. So I have great respect for them. Certainly the prize is deserved. We also interviewed Felix Baez, who was the physician that you may recall during the Ebola epidemic, was actually infected with Ebola in Africa. And after he was better, which was touch and go for a while, not only went back to donate his blood in Geneva, his plasma for to help with the treatment of new cases, but went back to Africa. He went back. You don't do that unless you're really committed. So I have tremendous respect, and hope that our film is able to actually convey that. I know that it's dated in many ways, but I realized when we were making it that the film Salud also addressed more than just Cuban internationalism in medicine and health. To me, at least as a producer, I learned a tremendous amount about why people were not getting health care, why health systems were not responding to the needs of their people around the world. We were in 5 countries, and it was really an eye-opening for me. And I think it's one of the reasons why the film is still being used in public health and medical and nursing curricula around the world today. You'll find things that are outdated, but I think the fundamental questions remain. Absolutely.
It's a fantastic film, and we look forward to your series 2 to episode 2 to update it. So I will just follow up from what you're saying to encourage everyone who is encourage the audience to support the international campaign to nominate Cuba's Henry Reeve International Medical Contingents for the Nobel Prize, to highlight, as we come out of the COVID-19 pandemic, the kind of world that we would rather see, a world of cooperation and solidarity. Gail, it's been fantastic talking to you, and I'd like to thank you for your time on behalf of the festival and on behalf of the audience. Thank you very much.
Thank you, and I do encourage folks to look at our journal, MEDICC Review, which I think will give you a deeper understanding of Cuba, its science, and its global health cooperation.
Thank you.